So I have to say that Jared and Mike and I are really looking forward to sharing this workshop with you on the 3 GIS tools for pandemic response and beyond. For this session, we're just going to assume that you know that GIS stands for Geographic Information Systems and that it's a technology system that makes sense of geographic data. The premier GIS system in the world is ArcGIS, which is built by Esri, and that is the company that the three of us work for. So I did want to be sure and emphasize that disclosure. But here's the thing, many of your organizations, probably most, already have several ArcGIS licenses available. So what we want to be able to do today is share with you what's become a very clear pattern for health organizations around the world, and it focuses on 3 easy-to-use tools. So here's how we're going to approach the session. I'll start with a brief introduction to GIS and especially WebGIS, and I'll share a little about the pattern that we've observed with the 3 specific tools during pandemic response. And then Mike and I are going to kind of tag team a little bit, going over each of the tools. So I'll provide the overview, and Mike's going to really show you step by step how to configure the tools for a specific use case that we're going to use as an example around vaccine hesitancy. And we'll also identify some other possible use cases for these tools that could really help your departments with multiple initiatives that may be going on beyond COVID-19. And I know that you're probably going to want to get your hands on the software, so we're going to share a slide with several short and free lessons to help you get up to speed very quickly. And of course, we're happy to share a PDF of these slides so that you can review the information and have easy access to those resource links. Then to wrap up this workshop, Jared's going to demonstrate next level dashboarding, leveraging international healthcare interoperability tools like HL7 and FHIR to automate reporting and display. And we expect that we'll probably have between 10 and 15 minutes at the end for your questions. So definitely as they occur to you, you can put them in the chat or the Q&A section for this session. Now you've probably noticed that mapped information has been front and center during the pandemic, and anybody could make the argument that GIS has perhaps never been more important than it is now. And it really makes sense when you think about the roots of GIS. It's a technology that's based on geography, and geography, as that science of our world, brings together our data with the relevant context in this way that helps us to more easily see and digest complexity and relationships and patterns in the data. And it helps us to understand, and it helps us to intelligently respond. And intelligent response has been critical as we all work together to fight this global pandemic. Now, one of the things that I think has really helped organizations around the world respond in that intelligent way is their ability to quickly adopt WebGIS patterns in their work. Now, some had already been doing this, but for many organizations, WebGIS was something kind of new. It became really popular because it's easy to use and quick to configure. You don't have to have a developer to get going. With WebGIS, you can interconnect, right, all of your tools and your data and make changes as your situations evolve. Certainly, that's a requirement when you're in the midst of an ongoing crisis. And of course, WebGIS enables sharing and collaboration on multiple levels. Maybe you just want to share internal to your organization, or maybe in a way that is distributed across a few organizations, or even open sharing with the public. So I thought I'd explain what exactly is WebGIS. Many of you are probably familiar with desktop GIS programs like ArcMap or ArcGIS Pro, and these are great tools that have powerful capabilities, especially along the lines of analytics. Now, WebGIS includes all of the other stuff. It's the apps and the APIs that work in an enterprise environment or in ArcGIS Online. The main takeaway here is that WebGIS is really all about connectivity. With a WebGIS pattern, you get interconnecting data and systems of all types, and it's all happening at the same time. And when you do things that way, you're really able to create a responsive organization. And that interconnectedness is enhanced by the fact that ArcGIS by design is an open platform. And what that means is that it can be really flexible. It can be extended in various ways, kind of customizable. It's interoperable using various standards and direct engineering technologies to make things work together, something that's been important but often missing for so long. And it is customizable in the sense that people can extend it with rich tools that they use every day, like Python, or integrate in open source tools like TensorFlow or R to build complex systems. And the success of this strategy is pretty strong. It's evidenced really by thousands, actually, if I'm to be honest, tens of thousands of heterogeneous systems that have been implemented using and powered by this platform. So at Esri, we've been talking about this whole concept of WebGIS, open platform tools and interoperability for a few years now. But I would say in the whole health industry, these concepts became a lot more popular during COVID-19. So why is that? Well, I think I often have to go back to the popularity of the Johns Hopkins University COVID-19 dashboard. I think it really made this explode on a global level for a couple of reasons. I mean, this dashboard was initially created in just a few hours, one evening by a graduate student in January of 2020. And actually, when you compare the current dashboard to the original, it has evolved and it's been modified several times without messing up the whole data structure. Kind of like when Johns Hopkins decided to add US counties back in the early spring of 2020. The good news is that the technology allowed Johns Hopkins to adapt the dashboard whenever they needed to as they went along. But why is it important? Why did it create interoperability? Well, I think it brought this worldwide attention, first off, to the value of map-based information for sharing in a pandemic. And Johns Hopkins had this goal early on. They decided to make their data open and publicly available so governments and organizations could simply use that data for their locale. They could take a few hours themselves and configure their own dashboard that suited their local situational awareness needs. And I don't know if you were aware, but this dashboard is actually the most viral map-based application in the history of the world. It has over 2 trillion views since the beginning of the pandemic. It amazes me when I try to really think of what that means. Hosting something like that, if you're an IT or informatics person, that could be expensive. But when you're doing it in the cloud using our infrastructure, Esri's infrastructure, you're kind of automatically covered. So a few benefits here. But Johns Hopkins inspired all of those local dashboards, and literally thousands have been made, sharing indicators and metrics related to the pandemic in all sorts of formats and colors that really spoke to the local audience. Now, the next thing that we saw happen in the pandemic from our perspective was people had this desire, particularly public health professionals, right, to pull information together about COVID in one place to tell a more complete and holistic story. So people started putting their dashboards into hub sites like websites and adding additional graphics and narrative and data and local resources that provided that much needed context for residents. And sometimes, we all know this, the data that was needed for decision making didn't exist yet. So we saw people use mobile survey tools and putting those to use to collect data on vaccine inventory and supplies, on grocery store inventory, employee status, and even they use them for registration forms for receiving vaccines. The uses for fast data collection, I would say, really blossomed through the local needs that arose, and of course, subsequent innovation. So today, Mike and I want to show you this powerful combination of Survey123 plus ArcGIS dashboards plus ArcGIS Hub, because we're seeing this grouping of products used over and over again for COVID-19 and for many other health challenges. So let's begin with the data collection piece, because of course, we always want and we always need more data. Well, finally, it's become a little bit easier to collect it. You know, in general, I would say that technology investments in mobile data collection have been huge over the last 6 to 8 years. Sometimes it seems like we've always had it, but Esri offers a number of field apps in ArcGIS that help to increase efficiency across all types of field activities, from modernizing and streamlining data collection to enabling all kinds of fieldwork assignments. And of course, each app that we provide includes that location intelligence perspective. So for the workshop today, we're going to focus on just the most popular of those field apps. It's called Survey123, and it can be used in a browser or on a tablet or a mobile phone. So before we get into the details of Survey123, I want to look at some of the benefits of digital data capture. The entire data management and collection process is really made easier when you're doing it in the digital world, because data, for example, are submitted in real time. So that means that managers can see the pace of data collection, the geographic coverage from where data is being collected, and which of the data collectors are regularly submitting data, so you can monitor that. There's no more manual data entry from your collection form into your database system. Because of that, with digital data collection, the data can be analyzed pretty immediately. It may also be more accurate because form designers can apply all sorts of domain value lists or response ranges, or they can include smart logic on questions so that actually answers that don't make any sense just aren't allowed. Now, operating costs could also be reduced because mobile data collection decreases the costs that are associated with form printing, with that double data entry and data cleaning processes. It's also likely to be more efficient for environmental health and safety compliance reporting requirements. So a lot of benefits to going digital, no matter the technology. So with that background, I want us to dive in a little deeper to the actual Survey123 application. So for the purposes of this workshop, we wanted to build out the tools to support what is a very current use case, and that is addressing vaccine hesitancy. One of the trends that we've seen in the last few months to get this idea of vaccine confidence is to survey various populations for their intent to be vaccinated with a COVID-19 vaccine. So let me give you an example. Bethlehem, Pennsylvania surveyed their own government workers, and they analyzed vaccine intent by job function with some very interesting results. Turns out police and fire staff are more vaccine hesitant than, of course, public health staff, which are more vaccine confident. So there was another example here where the community partnership, which is this amazing group, they're a continuum of care that supports people experiencing homelessness in the DC area. And they basically wanted to survey their homeless community to better understand the attitudes and the beliefs around the COVID vaccines. So with that background and why we're pursuing this line of thinking, I wanted to turn it over to Mike to show you how you can quickly build a survey to understand vaccine intent. Mike?
Great, thank you, Esty. And just to confirm, can you see my screen?
I can.
Awesome. All right, so to get started today, what we're gonna do is sign into our ArcGIS Online organization. Now, you may have received an email prior to this conference with instructions on how to get a free trial of the software. If you didn't get that email, again, feel free to reach out to SD or myself and we can provide some instructions after the conference here. So I'm going to put in just some credentials that I had created for just this conference here. And a good point to mention here as well is that ArcGIS Online works if your organization already has some kind of login system like SAML or just a multi-factor authentication system. So there are a few ways to launch Survey123, which is the tool we're going to be discussing primarily in this first segment. The simplest way to get to it is just by clicking the button in that app launcher in the top corner of the screen. Now, if you get into ArcGIS Online and you're not seeing this button here, there could be a few reasons for that. Typically, it's just that you haven't been allocated access to that tool by your organization's administrator. Everything in here is very secure. So just reach out to them and they can probably resolve that pretty quickly for you. Now, when you launch Survey123, you will potentially see a whole host of content from different members of your organization. These are surveys that are owned by others that you likely only have read-only access to. That's because they've decided to share it either to the organization or to the entire public. So this is a really great place to explore others' work within your organization. Don't duplicate anything if it's already been created, and you can even get links to existing surveys that you can take advantage of. But today, what we're going to be doing is building a new survey from scratch. So what we're going to do is very simply hit that new survey button, and now we see one of our very first design choices. Here we see how to create a new survey using the web designer. Again, what we're going to be using in this session. It's a very simple drag and drop experience, very simple logic. You can add dozens of survey question types and even some very basic cascading logic, which we'll discuss later. If you want to have some more complex logic, think of things like auto-populating questions based upon calculations, even referencing other pieces of content either internal to ArcGIS or external to ArcGIS. That's when you're going to want to use Survey123 Connect. Clicking on this button actually opens up a desktop tool for editing. It's based on Excel, very easy to use, but a little bit more intense. The Connect version, a fantastic functionality, is that it also supports multiple languages at the same time. So users can toggle to the best translation for them, and then all of that data ends up in the same data store, which we'll look at in a little bit here. So I think we just want to get started very quickly here. So let's start with a blank survey and give it a good name here. So we're going to go vaccine intent survey. We're going to give it a couple of tags just so we know that we can find this later. Makes it very easy for you to keep all these things organized. And then a summary as well. Again, we want to put in as much information here off the start, just so we can keep track of everything. And this name, as you're going to see momentarily, is going to be important because this is what all of our data is going to be stored as based off of that name there. So once you hit create, it does take a quick second. And that's because it's building out all of the folders and the services where all of this eventual data is going to get stored. And we'll see that in just a moment. But as you can see, just one or two clicks in, we're already on the designer page. So let's get started with some very basic questions. We can add a single line text question, maybe to collect someone's name. Again, very simple question type here to collect that information. We can bring in a drop-down question type. And this prompts us to give us a couple of choices for people to select as their response. And again, let's give this one a meaningful name as well. And now we have the ability here to put in different choices for that question. And yes, you could go through and hit the plus button if you have multiple choices and change that text. Or if you already have a list of some choices, maybe your organization has already done this out on paper before, you can just copy and paste that text in and it's going to auto-populate your choices for the selection. And again, we'll see this in action in just a moment. Other question types that we can bring in rating scales, we can bring in dates, emails, we can even add maps for collecting the geolocation of where that survey point was collected. We can even very popularly here to sort information out is create these groups where we can take these separate questions together and put them into kind of a pocket of information, which really makes answering surveys much easier. And it can even be collapsed to save space by default on your survey page. So my other favorite capability in Survey123 is the capability of cascading logic. So if you're a respondent and you're told to complete a 20 question form with some questions that are relevant and others that may not be relevant to you, respondents might not be likely to complete the whole survey. So Survey 123 allows us to show only questions when certain conditions are met. So for example, if I want to bring in a Likert scale, which gives us these range of degrees of answering a certain question, then asking individuals to explain their reasoning for vaccine intent. And again, you can put way more thought into these question uh, titles than I'm doing just here in this quick sample. And let's say we want to add in a box to capture, why they answered the way that they did. So again, let's put in some reasoning text at the box for this box here. And now what I want to do is set a rule for my Likert question. I want to say only if they disagreed with that statement do I want to capture their feedback. So let's set a rule, and we're going to say if they strongly disagree, I'd like them to explain their reasoning. If they disagreed, we can explain it. And actually, even if they're neutral, maybe I would want to capture that feedback as to why they have that sentiment. And very quickly here, we've built out already a pretty robust survey. So let's toggle over to C1 that I've baked out just a little bit more. So let's take a look at this version. So we can see that the drop-down questions that I've asked, we can ask a whole wide range of questions from numeric to more qualitative questions here. We can collect geolocation if you'd like to do so. And now here at the very end, we see this question survey where if I have a very high intent to get the COVID-19 vaccine, I'm very likely to get it. We're not too interested in capturing that feedback. That's great. Go get your survey and be on your way. But now if someone entered that they were not so likely to get the COVID-19 vaccine, we see them having this ability now to explain their reasoning below. And we'll go into a little more details later about what we can do with this information. But for right now, what I do want to toggle over to is the sharing capabilities of these surveys. When you finish designing your survey, you hit the publish button, and that's going to allow people to access these responses. We can hit collaborate, and this now gives us the options to select who can submit data to the survey and even who can see the ultimate results of the survey. And as you'll see, everything here is grayed out. But ultimately, what I can do is share the results with just myself. I can create a smaller collaboration of just myself and SD, for example. Or if this is something that we want the responses to be public, eventually you could potentially even make those responses public. But by default, everything is very compartmentalized and kept very, very private when you're building out the survey. So I'll take it back over to you, Esty.
Thanks, Mike. All right, so screen's being shared. So you'll just tell me if it isn't. I hope that everybody can see how easy it is to configure your own surveys. So I really wanted to share with you that I had this idea for a survey, and when I first opened the tool, I really had no instruction at all. I had never done it, but I found that interface that Mike showed to be really intuitive. It was very easy. So now I can create my own surveys in a snap. So now let's move on to making decisions, because obviously that's why we collect all of that data. We need to be able to understand what's going on in a pretty comprehensive way and make data-driven decisions as quickly as possible. So ArcGIS dashboards can really help us to do that in what is an engaging, an interactive, and actually a structured way. So I wanted to share a brief word about dashboards. Because there are several types, and they can be strategic or tactical, operational or informational. And I think we've all seen some of each of these kinds of dashboards related to COVID-19. I thought I'd show you a great example from the state of Nebraska, which is on their vaccine distribution efforts and is publicly available. Now their dashboard has several different tabs on it, so we're getting lots of information. Their overview dashboard in the upper left is the strategic part. It's got key performance indicators on their ability to administer the doses of vaccine that they've received, as well as they're looking at the overall adult population that's been vaccinated. Their second page of the dashboard in the upper right is very tactical. It's looking at the daily doses distributed. And I think this is a great visual to get at a glance how well they're ramping up their process. The next two tabs in their dashboard are both operational and informational as they share their stats on equitable distribution by demographic group and by geography. So for the demonstration, we're going to continue along the same line of vaccine intent, and Mike is going to show how you can configure a dashboard from that survey 123 data that was collected in the last step.
Great, thank you. So, like I mentioned earlier, all of our data is being stored in this secure and easily accessible place. So let's dive in now and explore that. Now, what you should know is that there's a few ways of getting to the data from Survey 123. And the first is actually directly within the Survey 123 application interface. So by clicking that Analyze tab, we can visualize the responses in a series of pre-generated charts and tables. No work has to be done here. You can print this report out, grab it, and go. You could even change these chart types on the fly from, say, a pie chart to a bar chart, depending on how you want to visualize that information. As we scroll down the report page here, we see one of my favorite visualization types, which is the word cloud. It's a very interesting way of exploring some common themes in free text responses. And all of this data can be downloaded into a variety of open data formats like Excel, shape files, and CSVs, all from this data tab as well. But if you guessed from the session title, we might want to make a more dynamic dashboard from this data. For example, allowing our community partners to find pockets in the community where they have the best shot at intervention. So let's go ahead now and build that out. Going back into our ArcGIS Online homepage, we're going to locate the source data for our survey. This is where all of those responses get stored. So we click on the content folder and we see a new folder that's the name that we spun up when we created the survey, which is here's the vaccine intent survey measurement 2. Now what I've actually done is gone ahead and completed another survey and populated with some answers that we can get started with today. And actually, if you will check the chat, there's a link to that data layer available for your use after the workshop to create your own dashboard using that ArcGIS Online trial account. So we've gone into this folder that's been created by Survey 123, and typically this is where people get hung up. Which one of these many items should I choose to build my dashboard? Well, let's break it down step by step here. There's the form item, and this is actually what we just built out. This is the survey 123, the survey layer. And if you clicked on this layer, it would actually just take you back to the designer page from earlier within survey 123. You can also use this link to get the link to the survey for people to actually complete it. So a very easy way to get access to your surveys here as well. There's also these hosted layers and these hosted view layers. The hosted layer is the source. This is where everything gets put into it. It has all of these high-level editing controls. It contains every single field that we created. Well, when you're sharing results out, you might not want to do that because of two reasons. Maybe you want to share results out to a colleague or to the public, but they don't need to see the name of the respondent or maybe personal information or phone numbers, email addresses. Views allow us to hide that information, so only the public sees the fields that you want to see. You can even limit it to a geographic region. Or in this case, the layer that I've just shared in the chat, that's a public layer. All of my other layers, which have these higher level controls and more information, they're just kept within my organization and shared privately. But this layer, I've taken just a cut of it and shared it to you all publicly. And that's the layer we're going to be building our dashboard off today is this hosted view. So we're going to click on this layer and we're going to open it up in a new map. Now we're diving into some more design choices that you can make. There is so much that you can do with these maps, but today we're just going to keep it very simple and work primarily with this layer of information. So what we're going to do here is just click on the symbology button, And in just 2 clicks, we've created a heat map of the responses. Again, these are all of the responses, regardless of high vaccine intent or low intent. And we're going to click the Done button here. Now I also have a design for my dashboard just in my head. The web page that maybe we want to embed this in later has a darker theme to it. So we want to change the base map from this typical topographic map to just this dark gray canvas layer. And there's many other base maps that you can take advantage of here, from imagery to these very cartographic community map layers. Very beautiful design there. But in this case, let's just keep it simple. We can also add in additional operational or reference layers that we want to have on this dashboard. So just again, in a few clicks, we can click Add, and we can browse the ArcGIS Living Atlas, which is the world's largest geospatial repository, and it's accessible to all ArcGIS users. And we can look for layers from the CDC, like the Social Vulnerability Index. I don't know if I can spell it right. There we go. So this is data directly from CDC on their most recent social vulnerability index, which happens to be from 2018 in the US. There's also a wide range of layers in here from the community, both in the US and internationally. So definitely a great thing to go look at the Living Atlas and see what you can take from the other community users before you start building things out yourself. There's also more real-time layers in here available, like weather. This is an important layer to be aware of as well, because maybe I don't want to send my community groups out to do surveys when there's inclement weather in part of my region or state. So that's a great layer that you can easily, in just a click, add it to your map as a reference layer. But like I said, today we're just going to keep it simple. So let's take a pause here and we're going to save our map. We're going to add in a title. We're going to put in some tags again, so it makes our item searchable. And finally, we're going to add in a description. And now we hit save. And what happens next is it enables a whole bunch of sharing options within ArcGIS. So in this case, we're actually going to build out a web application. Dashboards are just one of the dozens of types of configurable apps. Notice I said configurable. There's no coding required at any point here. These are the things that you can just be building very quickly in ArcGIS. But we do want to get started simply here and just build out something in ArcGIS dashboards. Let's go ahead and put a summary in and hit done. And automatically what's going to happen is it's going to take this map and add it into our dashboard builder. What I like to do here is just take a quick pause and look how simple this page is. Before we were looking at all of these map builders, which had buttons in every corner, analytical tools, all of these capabilities, whereas applications are simple. They're designed for a purpose, a very specific purpose, which really guides people who aren't familiar with GIS. So what we are going to do here in a moment is start adding in all of these things called widgets, which are those data-driven graphs. There are numbers in the corners of our screen we call indicators, and they're lists, all of the things you see on great dashboards. But it is important to take that quick pause with ArcGIS or any development platform and think about what's the question that we're trying to answer here. Personally, what I like to do is write that down on a post-it note and stick it to the corner of my screen. So as I'm building these things out, it's a reminder for what the end state is, what question we are trying to answer with this application. Otherwise, people just tend to get lost and they're like, this looks really good, but what am I supposed to use it for? So just a quick note there. So my goal is to build something out for my local community partners to use as a communication tool for building strategies for focusing on communities with low vaccine intent.
I'm going to add in an indicator. Lost my headset there.
We're going to add in an indicator, which just indicates the total number of responses that we've collected. So you'll notice that I hit the plus button and click the indicator widget. And now I'm asked for which layer should hydrate or power that widget. And in this case, it's that layer from my map. It's that vaccine intent data. And by default, this widget does exactly what I want. It's summarizing the total count of responses. I could even be a little bit more advanced and I can have it some kind of numeric data from the table. But in this case, we aren't collecting any numeric values, so I don't see any options for that. But let's go ahead here and just clean this up. We want to add some nice text formatting to this indicator. Back when I worked in integrated biosurveillance, I know that we like to specify this number as an N value. So let's put a parentheses around it. We're going to type the letter N, we'll hit equals, and we'll put a closed parenthesis around it. So very simple text editing is available within this. The next thing I want to do is remove this last update text from the corner because we could be looking at data that was collected last week, and this is survey data. I don't really need to know that it was updated up to the last second, so we can go ahead and remove that. And I hit done, and look how quickly that was. We've built our very first widget in just a few seconds. Now let's add in a chart to filter our content based upon the data. So again, I'm going to hit the plus button, and this time we're going to select serial chart. Now, serial charts in general, not just in ArcGIS, they can be very complex. We can have multiple different series of data. We can make line charts or bar charts. And so there are other sessions. If you Google Esri 360, we have a lot of videos out there from our other conferences on how to get really complex with these things. Or if you were to do a quick Google search for ArcGIS Dashboard Gallery, you can see what a lot of these other academic institutions are doing. They do some phenomenal serial charts that you can get inspiration from. So go, after the session, maybe go ahead and go check that out. But again, let's keep it simple here. We want to highlight our vaccine intent question. So in the category field, we're going to start adding in just that category of intent of COVID-19 vaccine. This looks good, but I do see that some of these are out of order. We want to sort that. So I can sort it by the number of the question. So this is a great end state. Also, you could do a statistic if you want to look most to least or least to most. Those are other ways that you can filter your data. And again, here I get some great insights to see, the majority of my respondents are likely to get the vaccine, or that's the most common category at least. So that's good to know. Let's go ahead and just resort this back into just order of same as the Likert scale, and we'll remove that last update text as well. Um, Before we get into some of the more functionality, I do also want to highlight that every single thing in dashboards and in many apps in ArcGIS, it can be customized. You can click on any of these colors and put in hex codes. So what that means is that you can make a dashboard that looks 100% native to your organization's website. A lot of agencies and groups have actually a color branding document for their agencies or groups theme. I've actually written one of them before. They're very long and they're very specific. So if that's ever a concern, you can change every single color here to meet those themes. But for now, let's just keep it as these standard colors. But I do want to get into and spend a little bit more time on the real magic of ArcGIS dashboards, which is the ability for these different widgets to interact with each other. So let's hypothetically say that I want to be able to click on these two groups, those who are not likely or unsure of getting the COVID-19 vaccine. I think I can influence those people. So what we're going to do is we're going to say, okay, I want to be able to select multiple of these different columns, and we can start adding in targets. These are the things that will be filtered when I make a selection. So I want to filter my map, and I want to filter the indicator that I just added to the chart, and we can click done. So now watch what happens. And let's go ahead and zoom out if you're into our map actually again, so you can see the data as well. When I click one of these different segments, so if I say not likely or unsure, it filters not just the map, but also the other indicators that we've created on this page. So very easy to start building out these very complex interactive applications, again, with no coding required. You can also reorder and resize everything on this page to look exactly the way that you want it to, whether that's on a desktop or consider if people will be looking at this on a mobile device. If it's mobile, maybe you want to stack it to be a little bit more vertical. And there's some really great blogs on that out there as well. But in this case, I think this is a pretty good place to start. So we're going to go ahead and save our dashboard. Because we are working in a web browser, we're all working from home. So if your internet connection goes out, you don't want to lose any work. So it's a great place to save our work here. But now just fitting with our theme, again, I can make this page just a little bit darker, so I can change the theme to a nice dark theme. And again, here we see all of the different colors that you could change to match your agency's or group's branding. So a lot of different options here to change that out very simply. Now, what I did was actually, after building this out, I spent about a little bit of an hour extra to add a few more widgets to a more baked out dashboard. I went out online and found a nice color palette that looks good for dashboarding, a couple of different colors, and I was able to make this here as well. I also shrunk down that end value indicator to be a little bit, less blatant on the page. Um, so what I've done is we've clicked this here, and as I click and filter these different widgets, you can see that it filters all of these different regions on my page. So, to take a step back, from the technology, I know this is a sample data set, but you can see here in the sample here that my group is mainly females who have a moderate vaccine intent, who are not Hispanic, who fall into a majority white category across all of these different age groups here. And even as I zoom into this map, I've added in another widget that looks at the plain text feedback from those individuals about why they might not be likely to get the COVID-19 vaccine. So about an hour of work to create a very dynamic product that is helpful to identify regions where these community partnerships might be the most successful. So thank you.
I think it's so cool, Mike. Now, the thing is that you create this dashboard and you need a place to share it. Maybe adding some additional narrative information, maybe you add a few other graphics or photos or videos to really ensure that your viewers are able to interpret the data in the way that you would intend for them to. Maybe you also want to include some other applications in this space to further engage with your community. So ArcGIS Hub is really a great solution for that because it's, like the others, easy to configure, it's cloud-based, and what it does is it really organizes people, data, and tools to help you accomplish your initiatives and your goals. So what exactly is ArcGIS Hub? Well, I often start with it's pretty much like a website, but it's super easy to stand up. The key message here, again, you'll hear us say it a few times, there's no coding required. Just like Survey123 and ArcGIS dashboards, you can get your work done quickly because everything's configurable. You can do things like share open data, create unlimited websites, organize around initiatives, like maybe you have one of your hub sites around COVID-19 or specifically around this idea of COVID-19 vaccination. ArcGIS Hub enables collaboration, very important, so that you can share with staff, external community members, or both. So making your hub site interactive by including apps and other ways that you can engage can really help to motivate and move community members so that they rally around a goal in kind of this focused way that you have decided on, that you've determined. You can drive that direction. And again, because ArcGIS Hub works with your other ArcGIS tools, you can benefit from this full system rather than having to piece together a number of different systems and tools. So it makes it just a bit easier. So importantly, when we're continuing this story around vaccine intent and vaccine hesitancy, I think it's worth knowing that ArcGIS Hub is supported in dozens of languages. And if you are in IT or informatics, I'm going to remind you of this again. Just think of it. This is a time of high volume traffic to public health websites. People have a thirst for information, particularly around COVID vaccines. I mean, we've seen websites crash or go offline for a while with too much traffic. This is one way that you can benefit from using ArcGIS Hub because it offloads that traffic from your infrastructure and it puts the burden on ours, and we're set up to handle that. So let's get back into the details here and see how easy it can be to use the Coronavirus Vaccine Distribution Hub solution. I have to say that slowly because it's a lot of words. Okay, Mike, you've got it.
Thank you. So to build out these dynamic web pages, again, we're going to return to the homepage of your ArcGIS online organization. And again, we're going to open up that app launcher and we're going to select the ArcGIS Hub icon. Like before, there are some permissions involved here. So if you don't see that button, just call your administrator. But it is a capability that's available to almost every single ArcGIS user by default. Like Survey 123, I can go into here and see all of the other hub sites that were created by members of my organization if they've decided to share it out either to the organization or to the public. But maybe we want to create a brand new one related to just COVID-19 vaccination. So what I'll do here is click on new and we'll start a new initiative. I can either create initiatives from scratch, which would be equivalent to launching something like Microsoft Word as a blank page. Uh, Great, you can have a lot of flexibility in what you want to do, or I can use a template. This is a lot like using Microsoft Word again and clicking one of those resume templates, for example. It's not everything I need, but it gets me off to a very quick start, with the formatting and the tools that I would like. And we've built out dozens of templates. Again, the session title here has, COVID-19 and beyond in it. Uh, think about how you can leverage this not just for, vaccine information, which is very important, but even using the same infrastructure for tracking citizen problem reporters. So, people reporting potholes and, community issues that need to be addressed by the government. You have things like capital project tracking. That's very similar to looking at things like a grant of how things are moving forward and the completion dates. In our case, we actually have a brand new solution that we've just released, just in the last few months here, called Coronavirus Vaccine Outreach. Yeah, now this one is going to be a little bit more tailored to the needs for ensuring that the population knows where to get their vaccine, and the information surrounding it. So we're going to go ahead here and activate that initiative. And it's going to ask us again for a name, just like everything else in ArcGIS. We're going to give it a good one. Going to go ahead and click go. And when we hit go, it's spinning up the web page for us. I should mention here that ArcGIS Hub Premium does support custom domains. So if you have a need for having your organization's URL, that is something that is supported. And just if you've been in the space of creating websites from scratch before, the conversations about hosting, certificates, domain names, all of that mess of material, that's being taken care of for us right now behind the scenes. We don't have to worry about it. You don't have to call your IT admin to maintain this thing, which is phenomenal. But while that's running, I do want to talk about, again, and Essie's brought this up, is accessibility. For a lot of these products, Esri has completed the voluntary product accessibility template. It's called a VPAT, which really helps people out with decisions related to things like five-way compliance. Now, what does that really mean? Accessibility. One factor is what we've mentioned earlier, which is language. If I'm not able to comprehend the things on the page, I'm not going to get much value out of it being available at all. So there's definitely a need for having those translations available. And also there's the discussion about not just being sighted or unsighted individuals. There's also individuals with cognitive needs or motor needs as well, or just speech capabilities. So being able to address this very wide spectrum of accessibility are things that you want to be considering in everything you build. Again, ArcGIS and beyond, of making sure that those core things are available within in what you're making. The last thing I do want to mention is while we're spinning up this site behind the scenes is our commitment to ensuring that this is a secure platform. And for that reason, we have guidance here for the US on HIPAA, but more in general about as you're collecting personally identifiable information, how should you be potentially treating that information? What are some general guidelines that you could be following to compare with your organization's standards for security? So these are all things that are available just with a quick search on Esri's website. So what I'm going to go ahead here is go back to our, let's go look at the live version and see what exactly we're getting, with all of the things that have just been deployed behind the scenes. You're getting all of this very rich content, the titles, the nice infographics on the phases of vaccine distribution that can be edited. As we scroll down, we see the ability to embed apps and dashboards. There's these nice graphics that come with the page as well that can be edited, and you can add your own text below it. It even comes with these other kind of micro embedded applications. In this case, we see another Survey 123. that's been built to let your citizens know if they're eligible to get vaccinated. Sorry, that's I got vaccinated. This one allows them to share their stories of vaccination, which is a really cool application as well to explore. Here it is, am I eligible? So if we open this one up, we see that people can answer questions about their current status. For example, if they're a healthcare worker, and if they are eligible to get the vaccine, it prompts them to go to a locator to find their nearest site. And if they aren't eligible, it prompts them to complete another survey to register for more information as the time comes. Again, beyond COVID, there are so many applications of this just to keep in mind behind the scenes. So know that all of these capabilities are available to you when you deploy that solution. Now, going into our solution that we just deployed, we see our title is in the URL up top. Again, that can be edited, or if you have a custom domain, you can have a premium license that allows you to change that. We can edit everything here. We can remove different sections of text. We can add new sections of text back in. Or related to what we just did, we can add into the layout a brand new iframe, which allows us to embed applications, and add in the URL of that dashboard that we just created in the last exercise. And now we see it embedding here on the web page, and we can adjust the size of the item as well. So let's bring that up to 850 pixels, a little bit bigger. And now we see it here available for the public to interact with and engage with. And now at the end of the day, we just need to hit save, and we can publish this out as a final draft of an application. I also do want to mention here that ArcGIS Hub is really good with compartmentalizing information. There's going to be a need for your public to see some things and others not to see everything else. Well, very quickly, just by clicking this button, I can share this site to only members of my organization who I've given a login to. Obviously, I could share it to the entire public, which would allow anyone with an internet connection to view this information. Or I can even create groups. This is really great for communities to see their hub site. Maybe just field workers who are out collecting information. They can be part of a group of people who can interact with these resources only behind a login. So a very wide spectrum of what's available here. And we even see people having a public-facing website and then a sub page just for the community workers. So one resource for everybody to go to, and then just if you have a login, you can see these smaller subsets of the web page. And again, what we saw in our survey was raw survey responses that were shared with the entire organization. Maybe you don't want to do that. So at every level of your content here, just be finite with how you're setting security controls. And you have a very wide range of what's available. And again, all of this capability from top to bottom was written with zero coding. So that was a very exciting thing. Back to you, Esty.
Thanks. That means I can do it since I'm not much of a coder. Not to say I haven't tried, but not necessarily my thing. Well, getting back to this, as I said in the beginning, this combination that we showed you, Survey 123 for the data collection, combined with real-time situational awareness using ArcGIS dashboards, exposed to your stakeholders and your communities on ArcGIS Hub, is a powerful combination, and we are seeing this repeated over and over again, which is telling us that people think it's pretty useful. So I thought that it might be helpful to you to dive in and learn this WebGIS pattern of use. So this is why we presented this today. And we just wanted to start with these 3 tools because I think that they can be used over and over again for any of your various goals and initiatives. So to spur your imagination, I thought I'd share a few examples with you. One of our favorites actually comes from Carleton County, Minnesota, and they use these 3 tools to support their mobile vaccination clinic. So they launched their workflow initially for delivering the flu vaccine because they use that as kind of a practice run for when they'd be ready when COVID-19 vaccines were available. And they have realized more than a 4-fold increase in the number of vaccines that they could deliver using these tools. So what did they use them for? They had a hub site for outreach. They had Survey 123 apps for pre-registration, consent, assessing satisfaction with the new process, and then dashboards for monitoring it. But they're really not alone. We've seen this pattern emerge for performing contact tracing, for modernizing the homeless point-in-time count, for combating opioid misuse, doing vector-borne disease surveillance and control work, performing restaurant inspections, and achieving overarching goals to understand and mitigate the impacts of the social determinants of health. In other words, the possibilities for these WebGIS tools are endless. So, how can you learn more and start to put these tools into practice for your organization? Well, I've provided links to learning paths and learning plans and pathways. They're separate, but they're the same. And I've provided links so that it makes it easier for you. You will have this PDF. What these are short, focused collections of lessons on Dashboard, Survey123, and ArcGIS Hub, so all of them. And at the bottom here, you can link to a free 21-day trial of ArcGIS Online, and that will give you all 3 of these apps in case you don't already happen to have the software in your organization. So make sure that you allot the time so that you don't let that trial expire before you get to the lessons. By the way, I should also mention that you might qualify for free licenses through our disaster response program, or deeply discounted licenses if you are an educational program or a nonprofit program. So we have different categories for each of those. We would be very happy to help guide you to those resources if they apply to you. But before we close this workshop, we covered the 3 tools, but we wanted to share some more about interoperability. We mentioned before how important that is, but I think you all know it can't be emphasized enough. So interoperability using standard data transfer languages is going to speed up your work. And as you listen to Jared, he's going to discuss this information. I would like for you to think about how this might take your dashboarding to the next level with real-time access to your data systems of record. So Jared, I'm going to pass it now back to you.
Thanks, Esty. All right, let me go ahead and get my screen shared. All right, can everybody see my screen and hear me?
Yes and yes.
Excellent. Well, thanks a lot, Esty, Mike. That was great, and I totally agree that that kind of trifecta of tools is something that we saw being leveraged, throughout the pandemic and even prior to the pandemic, just because that's a really standard workflow, across all industries and sectors, really. So I want to talk a little bit about healthcare interoperability. It's all over the news right now. I think in every after action report from this pandemic, there's going to be a lot of introspection, wondering why existing systems couldn't have been leveraged and why there was a lot of additional manual reporting that was required, really requiring people to report information at the busiest times of their careers, really when you have hospital surge. So I'm going to be talking about healthcare interoperability as it relates to ArcGIS technology. We answered a lot of disaster response requests throughout the pandemic, and a very interesting one came in from a group of kind of the who's who of healthcare IT, major EHR providers, and kind of international message language standards organizations. So we got involved with a project that's called the SANER project, which is the Situational Awareness for Novel Epidemic. And basically what it does is it takes information directly out of your electronic health record system, your central bed monitoring system, your asset tracking system, any other system of record that you have, and exposes it out as a measure report, which is basically a standardized message adhering to international HL7 or Health Level 7 standards, formatted through something called a FHIR API, and that's a fast healthcare interoperability resource. This is kind of, the international standard for messaging across the world for healthcare. It's how regional health information exchanges exchange data. It's how a lot of things happen so that people don't have to manually report. So once you kind of get that data exposed and available, Mike demonstrated how to use a Survey123 to collect that data. And we saw a lot of this, people collecting information on, the number of hospitalizations and, deaths through a number of different mechanisms. But, here is an example of a dashboard where we basically pulled that information. Each one of these individual facilities simulated standing up a FHIR server linked directly to their underlying systems. And now I can get a kind of a regional overview of what's going on across that region and kind of get that information available. Go ahead and refresh this thing. Get that information available across the region on where every single one of the facilities are at. And since there's a standard message language there, I can expose the number of available ventilators that I have, the number of available beds that I have, the ventilators that are in use. And you can see as it's reloading right now, I can see that regional view without having to have people report that individual information. Well, I can even go in and say, look at one of these particular facilities here. Let's go to Wilhelm, and this is using the same technology that that Mike showed before. So while now all my widgets are showing the information across that entire region, which is very useful for decision making, I can go in and click on any one particular facility and then go in there and see over space and time, what available beds do they have? Where have they surged over time? And what do they have going on? And it's all based on international standards, and it can be consumed in a GIS environment. So you have these nice visualizations tools. I can even go in and filter these reports up here to be able to look down more specifically to certain time frame. But being able to see this information rolled up, both at the macro and micro scale is good. But once you have it in a location intelligent environment, you can start making better decisions with the data. Here I'm using a ArcGIS web app builder application in a browser. Again, I know we've said this a lot, but everything you're seeing here, no coding required. So here I'm looking at the same points of the facilities, and I can look at this data all sorts of different ways. Here I'm simply color coding the data, showing what's at capacity, nearing capacity, where I have available beds, but I can do a lot more. I can go in here and look at this data all sorts of different ways. And so now I'm going ahead and looking at that data as a heat map, just like Mike showed in his demonstration there, where I can obscure the underlying record level information here if needed. I can present the patterns as a heat map, and I could even do something more advanced and maybe start looking at an emerging hotspot analysis where we have problems over time. So it's just a really nice way to visualize the data. And data is complicated. There's a lot of factors going on with everything here. So I can even go in and do some bivariate mapping, where here I'm looking at the data, I'm rendering the size of the points, and you saw this with the Johns Hopkins map, based on the number of new tests. And then I'm using the color to indicate, the number, the percentage or the number of new positive tests here. And of course, you can render percentages, you can render rates, you can render it based on any variable that you want. And that's great. It's just another way to visualize the data. But now you want to use the data to make some decisions, really guide policy. And we saw this throughout the pandemic. So here I've got all those facilities, but I want to go in here and say we've got a localized surge in a particular area. I want to drop a point on that map. I'm drawing a circular buffer or Euclidean as the crowfly buffer right now, which is fine. And then I'm going in here and producing a results directly from those facilities on how many available beds in that geographic area, how many available vents, ICU beds that are licensed versus ones that are available, ones that are occupied. Here I did as the crowfly distance, a circular buffer, but I could do a drive time analysis. I could do anything here. And the nice thing about it is I can instantly get all that information, download it, plug it into any other analytical environments or tools that you want to use. So it's just really, really useful stuff. And I can also use it for all sorts of different things here. Like say I want to go in now that I have this information and I've got surge at a particular facility and I want to offload my patients somewhere else. I want to start redirecting EMS providers into facilities that have capacity. That same underlying information can be available here as kind of a locator. And you can, specify, the distance that you want to look, drop a simple point on a map here, and immediately get information on all of the facilities that are in that area, and also get driving directions directly to those facilities. So, now I can do, put people where they need to be. And the nice thing about these tools here, they're mobile friendly also. So here, the same application that I developed and I'm viewing in a browser now is consumable by EMS providers, directly in their vehicles, by, individuals out in the field. And I can do the exact same thing. I can go ahead, and modify my search radius, look on my map, drop a point on that map the same exact way and get all the results and get driving directions, voice over navigation, anything that I need to have, very quick and easy. So it's just a really powerful tool. And, a lot of health organizations, don't have a lot of access to developers and really don't have access to developers to develop mobile applications. So it's a real big time saver there. And you can do other things with this data. All the information you need to make decisions aren't sitting in some electronic health record. We all understand that, health issues are complicated. There's the social and cultural determinants of health. So you can start using the other information that's available spatially and start looking at individual facilities, maybe try to look at costs. What's going on that's causing the problems in these particular areas? Here, I selected one of my facilities through another dashboard here, and I generated a drive time service area that was even using traffic around the area to see maybe 30-minute drive time. And here I can go in and I've pulled out that data. I can see that there's a high number of cardiovascular disease and obesity and what the, all the other health conditions here are, which may help me understand, why I have the surge in the area or one of the contributing factors. And I could even take that service area and start to enrich it to try to understand a little bit more. How many individuals in this area are on food stamps? Do they eat healthy foods? What do they spend on medical care? What type of insurance do they have? Where do they shop? What do they read? Pretty much anything to help either develop a targeted outreach campaign with them or better understand that community so I can connect with them. I'm going to go ahead and click over here. So, this is just all examples of how you can take this information, pull it out of systems of record, cut down on duplicate data entry, and rely on international standards so all these systems can communicate together. GIS is a great environment to be able to do this because every piece of data related to this pandemic has an inherent geospatial component, whether it's where somebody's coming from, where they were tested, where they reside, where they were treated. So it's just a really interesting tool to be able to leverage. And, since Esri is such a large company in so many different areas, we have integrated with industry standard tools like Jawarve, EM Resource, WebEOC, disease registries, vital record registries, immunization registries, CRMs, anything you can possibly imagine here. So the last thing I wanted to say is, these types of tools are the future. I mean, we've seen the stress and burden that's been put on individuals to try to report this information. And, many of the healthcare IT leaders that are out there have come out pretty strong, since this pandemic saying that we need to do things a different way. And from what I've seen, this is the future. Turn it back over to you, Esty.
Great, and Esty had to step out. She's actually presenting in a nice panel session following this. So actually, Jared, if you wouldn't mind, can you pull up that slide with the contact information?
Yes.
Yeah, I guess the final thing we want to say is, thank you all so much for your time. We recognize that these are very forward-leaning tools that we hope you can see integrated at all levels, from local people collecting information to, like Jared mentioned, hospital systems that are integrating with their system of record for these geospatial insights. GIS as a whole is just such a powerful tool. So what we'll do here is I think Jared will pull up our contact information. So you feel free to reach out to us and email us if you have any questions. I'm also dropping into the chat Jared, myself, and Esty's LinkedIn. We scan thousands of resources a week, looking for how GIS is being applied in the health space, how location intelligence as a whole is improving these health outcomes. So that's a really great spot to see what we find interesting that we try to share with all of our users inside of Esri and external to Esri. So at this time, I think Jared, we have a few questions in the chat if there's anything there that struck your attention.
Yeah, here, let me get this slide up here.
Yeah, I got one here. Oh, go ahead. Yeah.
There's all the content. Yeah, I answered a few of the questions in the chat. I don't see any open ones. Maybe we'll go back and look at the ones that were listed there. And anybody feel free to put any new questions in there. The first one was related to how to get access to this technology. And I think that was asked before Esty provided her last slide. That will be available. There's a lot of different ways to do it, whether it's that free trial account, talking to, the Esri distributor for your country or an account manager. There's academic licenses, there's research licenses, organizational licenses, all sorts of different options there. as well as the international grant program and other things. So, definitely look in there. And then there was another one that was about a CSV. Somebody asked if they could use a survey already stored as a CSV to make a dashboard. Mike, do you want to kind of touch on that one?
Sure. So this gets into what we discussed early on, which was the choice between using the Survey123 web designer, which has that nice drag and drop experience, very, very powerful still, but a little bit more easy to use. Now, if you use Survey123 Connect, and I can share my screen here for just a moment, and then Jared, you can take it back to go back to the slide. This is what Connect looks like. It's actually based in a Microsoft Excel form. So this is a format many people should be familiar with. And as you make changes to the Excel form, it actually updates the survey interface. So you can imagine if you had a CSV form with an organization that already has surveys built out, you can really just copy and paste or maybe take an entire column and post it into here and build surveys off of that information. Now, if you are a little bit more technical, there is even a Python API that can read in CSVs and reformat them and post them into surveys. But really just for the quickest way to get started, just opening up Survey123 Connect. That's the keyword there is Connect. And that would give you the ability then to bring in CSV information into one of these surveys. That's a great question. Thank you so much.
Yeah. There's also that drag and drop capability, in Web Maps too, because you can start a survey, directly from an underlying feature service. So you can just drag and drop these into a web map also, to start it and go from there. Because some people want to start their surveys from existing data also. So, as Esty mentioned with that open platform, I mean, our users are coming at GIS from all sorts of different ways. I've responded to a lot of emergencies when I was in the state of South Carolina, and every organization comes to you with a spreadsheet or a CSV, and they want to see it on a map. It's CSV is almost the international interoperability standard, unfortunately, but it's something that our technology can deal with very well.
It looks like we have 2 new questions too.
All right, so let's see here. Is the trial license valid outside of the US? My understanding that it is. I don't see any issue with that, but as I mentioned on the SD slide that she'll share out, is links to multiple methods to even do that on an international scale. And then here, how do you ensure the accuracy of bed availability in real time? Are you working with individual EHR vendors, HIEs, or hospitals? Excellent question. Do you want to take that, Mike, or do you want me to?
I'll let you take it. You're the EHR specialist.
Yeah. Esty mentioned meaningful use, or I think it was mentioned in her overview statement. And there is already a lot of information being reported into health registries from other underlying systems using this technology. So the bed availability, basically, all the information about bed availability, when somebody checks into a hospital, when they come through an ER, there's a system there. Then they get into a bed and there's a bed management system there. These systems can present the information out as kind of a web service using FHIR. And so it's culling that information directly from their underlying systems of record. You can have a manual queue where we review that information before you share it out. But basically what it is it drives the numbers directly from the underlying systems of record. So it's not somebody at 8 p.m. every night after the shift going in and enter some information. So they're pulling it from their reporting systems and exposing it. So it'll be as current as their systems are.
Well, great. Well, I think that's the last open question. So thank you all so much for your time and listening to us. And Esty will be back on the line just momentarily to answer all the hard questions that we've decided to pass on to her. So again, thank you so much to the conference organizers as well. It was great to be here, and stay in touch.